Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Delighted to welcome you here to our launch, our partnership launch with Good Boost. Ben Wilkins is here, the CEO of Good Boost, and very exciting times as we build these partnerships out. Our main aim is to empower people to improve and manage their own health and well-being. And working with Ben and other colleagues, we intend to do that. We intend to give people the tools to manage their own health and well-being. Over to you, Ben. I'm going to give you the floor. Introduction. Please tell us about the amazing work that you've been doing. And for me personally, this is a great day because myself and Ben have worked together for the last, well over 5 years. And Ben is a true pioneer in the work that he's been doing, particularly around MSK and the transformational methodologies that he's been using with Good Boost as well to empower people to manage their own health and well-being. So, Ben, delighted to welcome you to our launch.
Thank you so much, Gareth. And we're over the moon that after so many years of talking to actually officially talk about it in the way we are today. So we exist in terms of WHIS and Good Boost with, as you rightly say, this shared view of how necessary it is that people have the options available to themselves and in communities so they can better manage their own health, but also to support other people's health as well. What we see a lot within Good Boost is peer support and people being there to guide, support, and encourage other people in the self-management of their own condition. What we do as Good Boost is we work to transform any space into therapeutic places. We generally work with gyms, leisure centres, swimming pools, libraries, retirement settings. And we put a combination of AI technology, rugged tablet computers, and training for on-site staff so that they can create these tailored and personalized supported self-management programs that include therapeutic exercise, support, self-management education, wider emotional and social support through those peer-supported communities. Most of our work is known in the UK for our services within leisure centres and swimming pools. And this year, we'll be announcing this summer another partnership with a lot of very large health charities to support people in their own homes to manage their condition and be more active too. And a lot of this has been understanding that health self-management is complex. It has a lot of factors around motivation, encouragement, behavior change. And we very much focus on those peer-supported communities, that social and emotional support to give people the confidence and motivation to start moving more, to have fun, and then feel better.
That's fantastic, Ben. And we just had a quick look at the website there. And for those who want to check out Good Boost, please do, goodboost.ai. It's a fantastic resource. I think what I'm excited about is being able to work at scale with Ben. Also to work with investors to be able to scale Good Boost and deliver this in shall we say cities around the world. So that's what's very exciting. Ben, just tell us a little bit about quality assurance because you use digital technology. I was going through your website and the information you have here built to the highest standard, clinical and data quality. This is one of the key cornerstones of what we're doing as a partnership to make sure that people don't fall down the trap of having misinformation.
Absolutely. So we're a team of a high number of clinicians and researchers and experts in rehabilitation, therapeutic exercise, self-management, particularly for musculoskeletal conditions. We've worked incredibly hard to ensure that our clinical governance, our research, the expertise that informs our services is to the highest standard they can be. We work incredibly hard in terms of making sure from a data protection, cybersecurity, that we implement everything necessary to protect our users' identity, their data, and we've achieved all the kite marks as a result, and we are achieving more this year as well. We are currently working to achieve even more that we will announce, and we're hoping in the next 2 months publicly too. And this is critical in terms of putting technology into people's hands to manage their health, that it's around the quality, the clinical governance, the safety, not just from a health perspective, but data and cybersecurity too.
I mean, maybe just from your perspective, last few minutes that we have, because it's a short announcement. It's just basically to make this announcement live and to build on this partnership. But maybe give people an insight into the reasons why Boost exists and why we're forming this partnership in terms of the clinical need that's out there at the moment and the challenges that we face as a community and a society.
Yeah, so MSK conditions affect about 1.7 billion worldwide. Talking about all forms of the need for rehabilitation, there's about 2.4 billion people in need worldwide. And this is by the World Health Organization stats and data. And the WHO have also highlighted that at the end of this decade, we have around a 10 million shortage of healthcare professionals. So we've got fewer clinicians to deliver services. Health budgets are being stretched, and we are struggling in the UK, but also globally around health system resource and availability to support people. Communicable diseases, things like arthritis, musculoskeletal conditions, but other inflammatory mediated conditions such as diabetes, heart disease. There is a huge connection to changes in lifestyles, things like being more active and other lifestyle changes around diet, which can have a real dramatic impact on the risk of those conditions and the prevalence of them as well. So we are working to make sure that we can put services and solutions into communities and into people's hands to manage that isn't dependent on clinicians, isn't dependent on traditional health systems and structures and buildings and spaces, where actually we can leverage these existing community spaces. There are over 200,000 gyms on the planet, over 500,000 public pools on the planet, where we can put services there that's in the heart of every community. It means that the community have the autonomy and ownership of how they can manage their health.
That's brilliant, Ben. So look, we'll wrap this up. I think we've covered everything that we need. This is a wonderful partnership, and we're going to be making a number of partnership announcements over the next few weeks. You can join us on Monday. Actually, we're partnering with Red January, so do join us there. Our mission is to empower people to manage their own health and well-being. We're doing this through partnerships and collaboration. And for investors, impact investors, and family offices and others who are interested in getting involved and want to support our work, please reach out to us. We're open, and we're also going to empower people and give people the tools to manage their own health and well-being. So from this Friday afternoon, myself and Ben, delighted to welcome you to our launch. And we very much look forward to working with you, over the next couple of weeks, months, and years. So for myself and Ben, thanks very much. Thanks, Ben.
Thank you, Gareth.